tobacco-flavored products consisting of $30 billion. Prohibition is not the answer. History shows us that prohibition drives activity underground to the illicit market, and that the illicit market undermines underage prevention efforts, promotes criminal activity, and costs governments billions in lost revenue, all of which add to the already heavy burden of our hardworking police officers. All of those on this panel agree that smoking is a public health issue and are asking the FDA to meet and work with law enforcement to discuss how this will play out at the state and local level. Our focus today will be on the proposed FDA ban, and we are asking why law enforcement is being tasked with policing a public health issue that is better served through education, treatment, and the effective use of tobacco harm reduction products, including cessation, that have led to historical low levels of smoking amongst both adults and teenagers. Numerous studies have been conducted which speak to the popularity of menthol cigarettes, particularly among Black and Hispanic Americans. According to the Centers for Disease Control, 77% of Black smokers prefer menthol cigarettes, a result the CDC claims is of many years of aggressive targeting and marketing to Black smokers to buy these products. Other reputable sources place the number as high as 85%. Claims of targeting are based on ads that ran 40 plus years ago. No such ads and targeting exists today. Targeting by the tobacco industry was wrong and has been made illegal by federal law since 1998 with severe penalties and fines. While there may be competing public health concerns for banning this product from sale, a ban on the sale of menthol products will create an illicit market for these products. The task of enforcing that ban will in fact fall on the nation's police. I'd like to start by introducing our panel. So Michelle Minton is a senior analyst for Reason Foundation, and we'll be talking about the data and the science. Chief Rodney Bryant just recently retired as the chief of Atlanta Police Department and currently is the president of Noble. Peter Forcelli is a retired ATF director as well as working for the NYPD. And John Adler is also a 26-year veteran of federal law enforcement. So rather than read your biographies, I really think it's important to link your experience to the topic at hand. So I'm going to start by asking questions. And Michelle, I'm going to, start with you. What does the data tell us about the costs of tobacco bans and their impact on smoking, health, and the illicit market? In particular, I know we're going to be looking at Massachusetts, where recent research has showed that experiment to ban menthol products the last 3 years has caused really some unintended consequences.
Yeah, Dan, so, Massachusetts obviously being the first state in the nation to ban flavored tobacco products. From what we've seen in our research, it is as you would expect. A lot of the sales, more than the sales that declined in the state of Massachusetts, for example, bled over into the borders of neighboring states. And what the result was this on public health in the state of Massachusetts was not much. It doesn't seem like smoking went down significantly more in Massachusetts than in other states that didn't have a similar ban, but we actually saw, smoking among Black adult men did go down a significant degree, but smoking among Black adult women went up by a higher degree. So overall, what you have is a higher smoking rate post-ban among Black adults in Massachusetts. So, if the goal of a menthol ban, for example, is to specifically target in a helpful way this population, it doesn't seem to be doing that. And then on top of that, of course, are the over 100 million, 127 million in lost revenue to the state of Massachusetts that is also concurrently trying to enforce what I think is an unenforceable prohibition.
So Michelle, can you talk about your expertise and a little bit about your biography and what brought you here at this point?
So I've been writing about vice issues, for lack of a better term, gambling, alcohol, food, drugs, and tobacco, obviously for the last 16 years of my career. And I come at it from a just sane policy perspective, what's best for consumers, what's going to work, what works with the way human beings naturally operate, and what's frankly is not going to work. And from the history of the drug war, what we've seen with every time a government tries to control, ban, prohibit a substance where there's a significant amount of demand, if you don't change the demand, all that happens is that demand just transforms into something else. It bleeds out into another market, or it turns into a different product to meet that demand that isn't necessarily better for people. Fentanyl, for example, is a really good example of how this happened when we tried to control opioid use. And then the illicit markets, very savvy, came up with a different type of drug that they could move around more easily and evade police and evade the authorities. So, my work, I came to this because I was writing about alcohol, gambling, other things, and I watched over the course of a few years dozens of my friends who I was shocked were smoking in the first place, but I watched them quit smoking using tobacco harm reduction products like e-cigarettes. And then the conversation about bans began. And from my experience with drugs, I was like, not drugs personally, but, my experience with drug policy, I was aware of exactly where this was going to go. So that's how I got into this particular issue.
Fabulous. Chief, I'm going to roll over to you to really introduce yourself and talk about the work that you've done with Atlanta and how you are looking at, what is going on right now in the work that you're doing.
Thank you, Diane. Absolutely. As the chief of police in the city of Atlanta, as well as in almost every rank that I held ascending to that position, I thought that it was always important that you build a relationship with the community that you serve. In all actuality, as many of us get our authorities, our official authorities through governments and administrations, the reality is your true authority comes from the people that you serve. And so if you're not in a space where you can, they can trust upon you, believe in what you're doing, it makes it very challenging for what it is that you're supposed to do. And so that's where most of my work have been, not just in laying out the policies and procedures for our department and leading the men and women of a wonderful police department, but also building that relationship within the community.
Thank you. John, if you could talk about your biography and what brought you to this, and then what I'll do is come back around and ask kind of some really specific questions. You have some really very, very interesting broad experience on this topic. And I think a lot of what I'm seeing across the country relative to this issue is that police agencies, police executives, street level cops, union members have no idea what's happening on this and are completely surprised that this is occurring.
Yes, thanks, Diane. So by way of my brief background, in addition to having served 26 years in federal law enforcement and having worked cases involving illicit tobacco products being smuggled in, counterfeit cigarettes and so forth, I also served as the Federal Law Enforcement Officer Association president, as the lead advocate for federal law enforcement. I'm currently the president of their foundation. And more recently was the former director of the Department of Justice, Bureau of Justice Assistance. So I sort of come at this from an investigative perspective, a policy perspective, an advocate perspective, and even from the grant oversight viewpoint in terms of what programs work best to deal with certain problems. And there are a lot of parallels by way of example that can be drawn to the issue of illicit drugs. So my personal interest here is the reoccurring sad trend of unfunded federal mandates that take place where the mandate is rolled out prior to bringing the relevant law enforcement expertise to the table first to discuss alternatives and the anticipated impact. And, formally serving as a national advocate in federal law enforcement, working with my state and local, tribal and county partners, it was always a reoccurring issue where state and local were burdened. They were the beneficiary of the federal mandate that came out, But the thing that was always said back after the mandate was released and no one was allowed to offer input up front is, you folks need to put your money where your mandate is. And ultimately, the chief can speak on this, Pete can as well. There are consequences of placing additional policing burdens on police departments who are already understaffed and under-resourced. It creates officer safety issues. It impacts community relations. You know, someone may talk about the Eric Garner situation, which was tragic. And for me, all of this is avoidable. We need to rethink our approach to rolling out these mandates and consider, and I think it was already said by Michelle, there are reasonable alternatives. You know, we can't ban our way out of a health problem. We need to look at more enlightened approaches, similar to the way we're trying to deal with the drug issues.
Thank you very much on that. You know, it's really interesting. And as we go through kind of unfunded mandates, you know, the things that stand out to me are really, really incredible when you start looking at the billions of dollars that are involved, right? You know, I go back to this proposal could result in annual losses of approximately $43.5 billion in government revenue. That's a huge chunk of money. And, you know, and how does that play out in the street, right? And so I really like to also look at, you know, the underinvesting in law enforcement right now is going to lead to a greater and larger illicit market that's unregulated. And it's unheard of right now to think about this, is that we are going from a regulated market and willing to abdicate control of that regulated market and hand it over to the worst actors in our society, which is the cartels. So we're creating a $30 billion funding stream that we know that's going to be much greater. And how is that going to drive up violence, safety issues, people dying from unregulated products? There's just a lot of things that I think have not been thought through. And so, Peter, I'd love for you to do your introduction, and I love your bio, because one day I want to hear your story about being involved in exonerating 8 innocent people. That's, you know, big kudos to you, because I think that should be part of our work, is not just preventing harm, but supporting justice.
Yeah, well, thank you. And listen, I always felt it was part of my duty to uphold my word to the people, right? That's who we serve, the people. When you swear an oath to the Constitution, you're not really swearing an oath to that document as much as you're swearing an oath to the people that it represents. This is a great conversation. You know, I started my career with the NYPD back in 1987. I walked the beat. I had to build trust with the community. You're alone. You know, you learn that learning to relate to people is such an important tool. As you became a homicide detective, saw a lot of death that was a result of the illicit market. Back then, it was mostly the drug market. I left the NYPD after 15 years of service and became an ATF agent in New York, where I specialized in home invasion robbery investigations. And the concern is those groups, I mean, occasionally you'd have someone who would target like a merchant or someone who was involved in legitimate business because they knew that they had money in their house. But the vast majority of those robberies involved people who were targeting people who were involved in illicit markets because they knew that they possessed money that would not be reported stolen to police. Now, those groups were a part of I guess you would say, an underworld within the criminal underworld. Obviously, very violent people. But let's look at the surface. You know, I started beneath the surface. In many parts of the country, Albanian organized crime, Italian organized crime, Russian organized crime, Hezbollah, other terror groups have profited from smuggling tobacco products. And part of the reason is, unlike narcotics, they don't come with a severe penalty for smuggling, but they come with tremendous amount of profit. So it's a high reward, low risk type of thing. So what you had, in essence, was you had these criminal groups that were smuggling products throughout the United States and in Canada, I saw, and also in Mexico, where the person that's actually doing this, the the stuff on the street where the police are most likely to come into contact with are going to be young people, often of color, right? So you have these people that are out there getting confronted by police because they're selling an illicit product. Meanwhile, the folks making a lot of money aren't that young kid in the street who's just trying to put food on the table. You know, don't want to oversympathize those people because they're breaking the law. But when you look at it, is that really the sort of enforcement that police need to be engaged in when they're supposed to be building trust with the community? There's a bigger problem, like I said earlier. Aside from organized crime, terror groups utilize tobacco smuggling as a means to fund what they do. Organized crime groups do as well. And what they're taking that money and doing with it is horrifying. Drug groups, the cartels, they use the money they make to purchase firearms in the United States, to smuggle people from other countries into the United States. Obviously know that they're smuggling drugs laced with fentanyl that comes from China into the United States. My fear is that if we start banning tobacco products or certain types of tobacco products, we're creating opportunities for these groups. And I can go back to as recently as within the last 2 weeks, when you look at the Jalisco cartel. They detonated 7 roadside bombs, killing 4 police officers, wounding 2 others, and 2 other civilians were killed. 12 other people were injured. These roadside bombs just south of our border in Mexico. The Jalisco cartel is estimated to make about $4 billion a year in their illicit tobacco trade. That's now. That's where tobacco products aren't banned here yet. I mean, why in the name of God would we open up additional opportunities for them to make more money? And again, going back to what I was saying earlier about the fentanyl being placed into our opioids, God knows what they would place into tobacco products if they were to get further involved with the Chinese government. The CCP obviously has a 100-year plan that they're sticking with to damage the United States so that they can become the world superpower. Why would we want to give an opportunity for the CCP, who also has a tremendous ability to produce tobacco products, to start additional smuggling routes into the United States that can harm our people? And when you look at the fact that popping a pill can kill a teenager, like it has hundreds of thousands of them in the United States, lighting up a cigarette doesn't just affect the person smoking that cigarette. It affects the people in close proximity of them. So, I mean, I just think with this particular proposed legislation, I've said it before, the road to hell is paved with good intentions. And I'm not going to doubt that these folks are trying to propose this for good reasons, but I don't think that they've thought it through about the money these groups will make and about the harm that it'll cause peripherally.
Thanks, Pete. It's really interesting. I don't think people understand the magnitude of the current illicit market. The Institution of Medicine estimates that the illicit market for cigarettes in the United States is currently between 8.5% to 21% nationwide. It's very problematic, obviously, I think, as you said, along the borders. And in 2020, an estimated 880 million packs of cigarettes were smuggled in the southern border states alone. A 2015 U.S. State Department report highlights that serious crimes linked to the illicit tobacco traffic included, as you noted, violent crime, property crimes, human trafficking, and terrorism. And so, as we continue to have these really critically important discussions, I want to suggest that we want to partner with the FDA. Let's create working groups that talk about these issues and how we mitigate the harms while supporting public health interventions that will, in fact, mitigate smoking. Michelle, I'd love to go back to the data. And in Canada, I think also had this experience, and I know that you're going to highlight some of the Massachusetts issues specifically. And what's drug displacement look like around this issue in particular?
Right. So I'm going to show a little bit of a slide here because my colleague, Jacob James Rich, he did some numbers crunching when it came to the 12 months following Massachusetts prohibition of flavored tobacco, including menthol cigarettes, flavored e-cigarettes, all of the products. And that went into effect in June 2020. So my colleague, JJ, he used monthly retailer to wholesaler data, which is shipments, which actually captures all of the cigarette distribution in the country versus like something like Nielsen data, which captures only about 30% of it or so. So I'm going to share my screen now. Hopefully this works. All right, so you can see here. So this is, this is just right after the ban in January, and the dark blue represents a decrease in cigarette sales, and bright red is an increase in cigarette sales. So you can see right here, this is basically, obviously not a whole lot of menthol cigarette sales in Massachusetts at this time. But then if you go all the way down to basically a year after the ban in December 2020, you can see the red, the bleeding outside of Massachusetts, directly on the borders of Massachusetts and the county. And okay, I'm gonna stop that share. And what's interesting is if you look at the revenues that are around the state, for example, like New Hampshire, in the year following the prohibition of menthol cigarettes, New Hampshire saw an uptick of about 26 million cigarettes sold, of menthol cigarettes sold. I think they saw menthol cigarettes increase by 90% in the first 6 months of Massachusetts, of their neighbors banning menthol cigarettes. And it's the same in a few other states like Rhode Island, where, and these are the states, mind you, their tax revenue in the post-ban era, post-Massachusetts ban, their tax revenue from cigarettes increased, which is weird because most states see their cigarette excise taxes decreasing as smoking decreases. And in these states it increased, but also it increased after years of decreases. So what we observed from this month-to-month data is that the sales were displaced. They didn't stop, they just went outside of Massachusetts, and all Massachusetts did was divert all of that tax revenue into other states and into other people's hands. So that's what we found the data. And we've seen this before as well in other countries in the world, Canada, as you mentioned, the Netherlands, Finland, a few others. And what we're seeing there is, the populations differ, geography differs. There's some illicit market use. A lot of people are purchasing their menthol cigarettes in other countries that aren't necessarily party to the EU's prohibition on menthol cigarettes. But interestingly, what we're seeing a lot of are people using flavor accessories. And I think this is a particular problem when it comes to banning menthol cigarettes that the FDA and a lot of other public health individuals pushing for a ban haven't fully considered. How easy it is to purchase legal non-mentholated cigarettes and make them mentholated by buying flavor beads, flavor cards. This is what they're seeing in a few other countries. A lot of the menthol smokers post-ban simply, if they don't go to the illicit market, if they don't go to equally harmful non-mentholated cigarettes, they use these accessories. And again, we don't necessarily know what's in those. We don't know where they're coming from, where people are getting them. And that's where problems happen. If people remember in 2019, there's an outbreak of a supposedly e-cigarette related lung injury, which was actually stemming from adulterated illicit cannabis vaporizers that were coming in from out of the country. And the people who created it, they just didn't do enough research, I suppose, and added vitamin E acetate into the mix, which when inhaled by the lungs causes severe lung injuries. So that's, we saw it spread out through the country. And, if we ban menthol cigarettes, if we ban certain types of vapes, and we send millions of American adults into the illicit market, the market will meet that demand. I mean, I think everyone here on this panel is probably very aware of this, but other people might not be aware of how sophisticated the illicit trade, the people who are involved in illicit trade are. They've evaded American authorities for many, many, many decades when it comes to harder substances and with even greater penalties. When it comes to tobacco, it's a fairly easy thing to make. You can grow it in country and then flavor it afterwards, or purchase it, import it, and flavor it here.
Yeah. Recent news that's coming out of state level criminal bans. And again, let's just talk Massachusetts. And it's the perfect example of how our concerns have become like a reality. 3 years after implementing, we know illegal tobacco smuggling operations are ruling the market in Massachusetts. And we're getting that from their own report. This is from a Massachusetts, working group document. And in addition, illegal tobacco seizures have skyrocketed following the ban on menthol cigarettes and other flavored forms of tobacco. Law enforcement, police agencies in Massachusetts have confiscated huge amounts of illegal products, literally straining the state's ability to even store evidence. They don't know what to do with it. They have warehouses. And so again, count the cost. What is it costing in order to process this amount of tobacco products? What's the cost and the impact on forensic lab testing, on prosecutions. And so, you know, as we go through this, I think we also have to be really aware that we need to also bring prosecutors into this conversation. How's it going to impact their workload, their capacity? Who's going to be funding? Where's the money coming from? How do we test, maintain evidence, and appropriately file criminal cases? So, you know, Chief, I'm going to go back to you. I think this is really important, is as the chief, and I know as a lieutenant, you know, we've had a couple situations where we had to manage where, you know, there were policy failures, you know, we're asked or tasked to enforce this law that, quite frankly, can be very unpopular. What do you see in your community? What did you see in Atlanta? Have you had any incidents that you wish that we didn't have to be doing this type of work, and how damaged can it be? How damaging can it be to an agency, especially around the issue of police legitimacy?
Absolutely, Diane. Great question. Clearly, what we find in policies such as this is quite often policies are addressed to are created to address a particular issue, but the lack of the unintended consequences aren't reviewed the exact same way. And here, what you will find is, in some way, law enforcement will have to play a significant role as it relates to addressing this issue, very much like you stated, how law enforcement had to intervene as it relates to interceding and investigating and capturing this illicit drug. We will also have to address how we are going after illicit markets as a whole. And it takes away from areas where law enforcement plays a significant role. Right now, throughout our country, many of us are still dealing with high homicide rates and violent crimes, where I think the police attention truly needs to be. Not to say that we will minimize any other crimes, but right now, this is where the focus of a lot of agencies will be on. And so when you implement a policy where you want police to intercede in a space that requires some other social resources to address, it becomes very problematic. Additionally, what happens is now, as it was stated, menthol cigarettes have are sold at a greater rate in minority areas as well as in poor communities, and it puts a fraction into a greater fraction into an area that is already fractured as it relates to policing and the community that we serve. And so I think that this will play a significant role in being more problematic in building that relationship and that level of trust as it relates to policing and the communities. I think that you cannot bring in policies like this without having the community be a part of it. I think that it will cause significant damage in our community and law enforcement, because now you're sending your strongest enforcement to address an issue that currently isn't that problematic.
Thank you very much, Chief. John, I want to come over to you because you kind of have that history of prohibition, and you know, you talked to me before about, you know, why we're not learning those lessons, but I want to start this by quoting a famous August Vollmer, who we all know here is the person who professionalized policing in America. And back in the 1920s and 30s, he was part of the Wickersham Commission. But what I'd like our audience is to listen to this quote and think about Vollmer is revered from a policing perspective. And in fact, the International Association of Chiefs of Police has one of their most important awards, which is the Forensic Science Award for a police agency. And he instituted beats, traffic cars, educational standards. I mean, the list goes on and on about what a visionary he was. But back in the late 20s or early 1930s, and please substitute tobacco for this, can the narcotic problem be met intelligently, so that it may be controlled and possibly reduced to the point where it need no longer be regarded as a menace to the young men and women of this country, and where drug users will not aggravate the crime conditions as they do at present. Stringent laws, spectacular police drives, vigorous prosecution, and imprisonment of addicts and peddlers have proved not only useless and enormously expensive as a means of correcting this evil, but they are also unjustifiably and unbelievably cruel in their application to the unfortunate drug victims. Repression has driven this vice underground and produced the narcotics smugglers and supply agents who have grown wealthy out of this evil practice and who by devious methods have stimulated traffic in drugs. Finally, and not the least of the evils associated with repression, the helpless addict has been forced to resort to crime in order to get money for the drug, which is absolutely indispensable for his comfortable existence. So, John, what do you think about that quote from Vollmer?
Reducing something to simplest terms, once again, we can't arrest our way out of a problem. We can't ban our way out of a problem. We've got to take a more enlightened approach. It's not simply a matter of someone who happens to be using drugs or becomes an addict is a societal inconvenience. Let's just lock them up. It doesn't work. It's just going to impact certain targeted communities, and it isn't going to advance us as a race, let alone targeting a specific segment of any population. You know, paralleling, and Diane, I'm glad you sort of wisely referenced substituting the word tobacco for drugs. So in my former BJA director role, I was fortunate to oversee many programs that dealt with programs to prevent drug addiction, to minimize, to educate. And I know a lot of those terms sometimes sort of don't resonate to meaningful programs. They're sort of ideas that are sometimes discarded, but it's sort of like what I call the Wile E. Coyote syndrome. If the first plan is well-intended but doesn't work, don't scrap it. Look what went wrong and work upon it. So in policing, we started diverting those drug collars where you pick someone up who's using, and rather than take them to a jail, which they're going to become a greater problem to correctional officers or anyone else or the sheriffs working the jail, get them to an intervention facility where those who have the expertise to engage in substance abuse and mental wellness issues can work with the person. And I think ultimately, if we as a society commit the resources to get those people in the earliest stages of addiction into programs, 30-day programs, rather than a one and done, where you give them, sort of like you give blood, they give you a little juice and a cookie, and out you go. And it's sort of a similar treatment process now. We need to commit more because we have to realize that we're not going to solve anything. We're just buying more Band-Aids and throwing drug users back out onto the street. If you look at, in parallel again to the tobacco folks, one thing, and it comes back to what the chief said and Michelle said and Pete, the notion of the ban, just let's ban it. Let's look at the federal prison system. I know it was 1986 or at some point, the federal prison system banned cigarettes. Have the federal prisons been able to keep cigarettes out of the prisons?
Yeah.
No. Why not? Do you think they have good security? Yeah, I'd say so. Between, the cameras and the concertina wire and professional correctional officers, they're a damn good system. But drugs gets in. And what are the consequences? We got gang issues within the prisons. Correctional officers get hurt over cigarettes on a ban. So if we think we're going to keep these cigarettes out of the certain communities and impact our children, we're in dreamland. It's not going to happen. And I think that Michelle mentioned the harm reduction approach. We should be working together, FDA, law enforcement, the cigarette companies as well, to come up with a more intelligent approach. I don't think anyone is an advocate for death. No one's an advocate for cancer. But I got to throw down the Bravo Sierra card when you talk about jeopardizing the wellness of young children in low-income neighborhoods. My main concern, and I grew up in public housing and I live 100 yards from a housing project right now, is that those kids who I want them to have good lives their mortality is more jeopardized by bullets and drugs than tobacco. And in terms of medical wellness, their concern is heart disease and high blood pressure and hypertension based on diets impacted by lower income situations and advertising. So let's be honest in the conversation. But I think what we're all saying, and I'm honored to be on a panel like this with a lot of good expertise, and I enjoy listening to what everyone is saying. This is what FDA and other government agencies who come up with mandates need to recognize. There are people with good expertise and good hearts that you want to bring to the table up front to address serious issues. But again, coming back to your point, Diane, much like the drug situation, there is no magic wand. There is no abracadabra. It's gone. We've got to be more intelligent, more committed, and recognize that we have to have aggressive intervention on the drug side at an earlier point. As far as cigarettes go, banning is not going to keep them out. As Pete said, it's going to empower the cartels. China, it's the same thing with fentanyl. This is not a partisan issue. This is a practical issue. Everyone in law enforcement knows this. And it's just something that we don't want to concede. The financial impact, the loss of revenue, the lives, who's going to get most impacted, and empowering countries that we have an adversarial relationship with. That is not the solution, nor is it an enlightened approach.
John, it's interesting. Someone just popped a question, and I think this is important. This is to your point. And the question is, do you think bans on tobacco products will have a direct impact on officer safety and wellness nationally? And you talked about this, history repeating itself. I know, unfortunately, I have friends who are on the memorial wall. Every time I go to Washington, D.C., I visit. It is one of the most moving places for me. I'm really proud of my career. And, the loss of our officers is really critically important. And I just go back to alcohol prohibition. Do you want to speak to that a little bit?
Sure. Yeah, and that just prompted me. I want to thank Thomas and the National Law Enforcement Officers Memorial Fund for supporting this particular podcast. That's the entity that helps us honor our fallen as well as make it safer for those who serve, and also sort of engage the community to better understand the history and career of law enforcement. In terms of officer safety and community safety as well, I mentioned Eric Garner earlier, but going back to prohibition. So 1920 to 1933, we see a clear, disheartening spike in officer fatalities during the period of prohibition. I think, in fact, in 1930, we lost 316 officers, and they weren't from vehicular or 9/11 toxins, the things we're confronted with these days, or even COVID related. These were mostly violent use of force encounters. 300 officers killed. We do not want to replicate that. Now, we can go from Al Capone to the cartels and other organized crime units. There is too much of a profit. I think Pete hit on this. It's too much of a profit for organized crime components to ignore this. I do not want police officers getting hurt or killed enforcing this when there's a much more intelligent approach. I don't want members of the community. I don't want Eric Garner to have to die because of this. And I don't want to say nonsense. It's relevant, but this makes no sense. We have to be smarter. We have to be more thought-based in our approach. We don't want to create more friction. The chief hit on this. The whole idea and the evolution of law enforcement is eliminating the pronouns us and them. We are the community. We're a part of the community. So when you approach this ban situation, unfortunately, it's going to take us many steps back and increase the chances of these negative use of force conflicts that we do not want.
So, Chief, before I go back over to Pete, I see you're unmuted, and I want you to look at that wellness question. I know my career ended in 2004, and we did a lot of I did a lot of police recruiting, retention, and, standards. One of the things that we saw was back then was from a hiring practice that we were starting to look at preventing police officers and potential firefighter candidates from even smoking. Like, there's this very interesting perspective when we start tying into, job standards. But I think part of the other question is, how did your cops feel about enforcing unpopular laws?
Absolutely. I could tell you, oddly enough, very similar to laws that was clearly unpopular is in the state of Georgia, there was a mandate that people had to wear masks during the COVID period. And if they were in large gatherings, law enforcement was obligated to go in and address that and address the people not wearing masks. And it was very unpopular. And we had very little actions as it relates to officers intervening in that space. But clearly, as it's been stated so well, that clearly put a policy in place like this will elevate an illicit market as it relates to cigarettes. And right now we depend on the regulations in place to manage that. And then you talk about recruitment. Many agencies are currently in flux as it relates to how to address the marijuana situation. As many cities and states currently are relaxing the issues of marijuana, so does the police department, these law enforcement agencies. And we recognize that this generation don't see it the exact same way. And so that's why we have this adjustment. But again, what is also missing is many of our police officers smoke cigarettes to this day. And we will find that they will do like much of the society continue, because if cigarettes is an addiction or a dependency currently, people will feel that in some kind of way. And police officers and law enforcement officers aren't exempt from it. And what we will find, sadly to say, is that they will go, as it's been stated so eloquently, that to the unregulated and what China could do to us in the illicit market. And I think it would be, we'd see something that we hadn't seen in our country before.
Yeah, thank you very much for that, Chief. Pete, I recently got a copy of a letter that was addressed to the FDA by 4 senators that are really concerned about the issue of the border and terrorism and drug cartels. And what the senators have asked, and this is a direct quote out of their letter, is before finalizing any tobacco prohibition and its limitations, the FDA should consult with agencies that fight Mexican cartels on a daily basis. These agencies include, the usual suspects, DEA, ATF, Customs and Border. And they note something that I think is so important. There's significant risk that in absence of a regulated market, again, we're handing over a $30 billion market that's going to be worth even more money to bad actors if we do this, is these agencies need to understand exactly the impact. And so I think even at the federal level, you see congressional representatives that are saying, hey, wait a minute, let's slow this process down. Let's talk to the experts. I just saw, I think yesterday was Congresswoman Sintma, I never pronounced her name correctly, out of Arizona, who said, let the states decide. We're letting the states decide on a case-by-case basis with cannabis right now, right? And it's complicated, and there's a lot of complexities to this issue. So what's your response to the senators asking for that? And I know you actually handled a pretty significant terrorism case that involved illicit tobacco smuggling. It'd be great for you to share that case.
Well, the tobacco smuggling that we dealt with normally was stuff where tobacco products, and this was mostly tax diversion, but again, it's an illicit market, stuff that was being smuggled from Virginia up to New York State that was using, that was the proceeds were being used to fund terrorism in Yemen. So it was the Houthi groups were smuggling tobacco products. Again, a lot of reward, very little risk, and they were sending that money overseas. But in reference to the letter, and I believe that was co-authored by Senator Rubio, look, there's a lot going on, and I'm going to be candid, and I hope I don't say anything that offends anybody. I had a trip planned to Mexico with my wife for our 30th anniversary to be canceled. The violence in Mexico has gotten completely off the hook. Like I mentioned earlier, we had 8 roadside bombs planted by the Jalisco cartel, 7 of which detonated, killing a bunch of people. I've seen National Drug Intelligence Center bulletins over the years, bodies skinned and hung in public showers in Mexico. We've all seen or heard of the stories of beheaded bodies or bodies just hung from bridges to send messages to elected officials or law enforcement in Mexico. And we've taken a softer approach, I think, than we should, because we don't want to offend our neighbor to the south. And I respect and understand that. But at the same time, I also have some really serious concerns. The cartels have gotten stronger, right? And then you look, the current administration in Mexico, not to offend them, AMLO, they call him, he has resisted cooperation with U.S. law enforcement, and to the point where they dismantled the DEA's vetted groups, which were folks who we could trust down there. They are limiting DEA's reach in Mexico, as well as that of the other 3-letter agencies and the intelligence community. Right now, Mexico is controlled by the cartels. I think anybody who denies that is somewhat delusional right now. And that represents a national security risk. Look, I don't want to see a single soul hurt in this country. And I'm not a smoker. I'm a lung cancer survivor myself. I never smoked a cigarette in my life. 9/11 caught up to me. I don't like to be around smokers, but I respect people's decisions to make people's rights to make decisions as adults. But look, at some point, we have to be concerned about what's happening in Mexico, how it affects us. And look, the other thing is people in Mexico who are legitimate, hardworking folks. I've gotten to know those people in my trips to Mexico when I worked on the southwest border myself. They are living under siege. And again, why would we even contemplate something that empowers the cartels to make even more money? And I'll go one step further. And again, I'm going to speak about some of my personal opinions of 35 years in law enforcement in the United States, both at the local level and at the federal level. And I worked in various parts of the country. We talk about marijuana. It's very confusing to some folks when you hear about a movement afoot to legalize marijuana products, while there's also a movement afoot to restrict or prohibit certain tobacco products. But I'm going to look at it really from where rubber meets the road perspective. I spent 5 years as a homicide detective in New York. I spent many years as an agent. I stood over a lot of dead bodies. Okay. When I talk about a lot of it came out of what you call the drug war. I've seen a lot of people over the years killed because of marijuana. It wasn't people who were robbing someone because they needed to get high on marijuana, or someone who was doing a burglary, because they need to get a fix marijuana. It was all drug dealer on drug dealer, marijuana dealer on marijuana dealer violence. And again, it's because it's an illicit market. So I'm not saying that we should legalize marijuana. I don't really have a strong opinion on that as a non-smoker myself. What I'll say is when you have an illicit market, violence comes with it. And why we want to turn over something that's now a regulated product to organized crime, terrorists, and cartels is mind-blowing to me. It doesn't make sense. Not from a public safety perspective, it doesn't make sense.
Yeah, it's interesting because we all have our experience and our anecdotes. And when you and I were talking yesterday, real brief, it reminded me that because my organization has been working on this issue for 10 years. We've been probably the only law enforcement nonprofit that has saw what was going to happen. And we started working on this issue in 2013 at the local and the state level, and even doing a little bit on the federal level. And in California, that banned menthol cigarettes, it started out kind of as a municipality by municipality level before the state started it. And I had the opportunity to fly out to Oakland on another issue that we were working on, but I met with an advocate in Oakland who took me to downtown Oakland. And to your point, Michelle, about displacement, is in the middle of the street, there was a big, U-Haul truck that when you popped it open, nothing but menthol cigarette packs in it that were brought in from Nevada, where I live, and being sold openly on the street. And it's happening. It's happening in our communities right now. And, right now, because business people, is give street creds to the kids who understand the market, is there's less risk with the tobacco, but it's still contraband, right? They can still get arrested. They can still suffer from all those unintended consequences. And you said that you and John happened to be in New York recently and walk through Chinatown. And can you, let our audience know about that?
Yeah, in fact, John had some of the tobacco products that he brought to a recent meeting we had. Look, when you look at the illicit tobacco products that come out of China, and I've seen these during my time as an agent as well, and this is what's going to be prevalent on the street if this becomes a big issue. The end of that cigarette might be a little bit of tobacco. And as you get further and further into that cigarette, closer to the filter, if it's a filtered cigarette, you start to find other things in there, sawdust, other substances, kitty litter. So we don't know what we're smoking, if you buy it off the street like that. And they sell it right out in the open on Canal Street in New York City. And New York City has a pretty big police department. They got other things going on right now. So, I mean, obviously, when you have something that's regulated, as our industry is now, it's safer. Is it perfectly safe? Absolutely not. But when you're smoking things that are made in other countries where there is no regulation, it's pretty scary. And then, like I said, I'm talking about stuff made in China now that's been smuggled there. Some of it could have been sitting around for a long time. As the Chinese have realized that they've done some damage to our country through smuggling fentanyl into, products that are sometimes made there, other times shipped through Mexico, what stops them from starting to taint our tobacco products to further cause destruction to people in the United States? So, I mean, it's just where we have something, again, it's not perfect. I don't think we'll ever find perfection. Why are we taking these risks for public safety and public health? When you think about it, I mean, that's a public health issue. Or like one of my colleagues said earlier, people want to smoke a mentholated cigarette and they can't get their hands on it. They'll try to flavor it themselves with God knows what, made perhaps in their bathtub or sink, like methamphetamine is made. Well, there's a significant public health concern there as well. So I just think that some of these ideas are very short-sighted. And I really do, like we were talking about here, I wish they would have talked to us. And again, I don't expect everybody to listen to me. I'm not that important, but at least hear everybody's side of the story.
Yeah, you know what? It's so critically important. Law enforcement has done a really amazing job in understanding public health concerns that have been driven by the opioid issue. When I first started doing this real hard advocacy work, there wasn't a single agency that issued naloxone, right? And then Quincy, Massachusetts was the leader that started this. And one of, I think, our jobs is all our policies should be based on the sanctity of life, use of force, drug enforcement, how everything interacts. And so, I'm looking at this as we know how to mitigate risky behavior from public health interventions. Locking people up doesn't do that. And is having cops be the responders to socioeconomic drivers of crime and health equity drivers of crime isn't the best use of our judicious resources. And so I want to go around and give everyone kind of this opportunity to answer this question and for you, Michelle, it's going to be a little bit different because you're not the law enforcement person, but I think it's really important to talk about the consumer, right? For you, from your years of analysis and research and the work that you've done in data, because I think data is so important and we don't have enough of it. And I'm going to ask you that question, John, is what are the costs associated with unfunded mandates and the burdens on the taxpayer, the consumer? And, feel free to cover everything from safety to the inappropriate use of fiscal resources. I'd love to hear your thoughts on this.
I mean, the costs on individuals, consumers, communities, it's enormous, and it's already happening even without a FDA mandated, national prohibition on menthol cigarettes. I think Peter mentioned that he was in New York City in Chinatown. And New York's where we get a lot of the evidence for the illicit market, because it's just, the illicit traffic in cigarettes is enormous in New York because the tax rate is very high in New York. So a lot of the cigarettes are just smuggled up from southern states like Virginia and sold in New York City. In some of these neighborhoods like Harlem in the South Bronx, the rates are upwards of 80%. 80% of the cigarettes being consumed in that area are not stamped in New York, aka they're illicit, coming from a different place. And researchers know this because they'll go into trash cans and look through the cartons and see which ones are stamped and which ones aren't. So those are enormous rates. And if you read some qualitative studies where they're talking to the smokers in these neighborhoods, they don't see their street dealers in these, Lucy's, for example, they're cheaper. The people who live in these communities see those dealers as part of their community. They are helping them get a thing that they want at a cheaper price that they see as being raised in price out of their hands. They had no say in it. No one listened to them. No one cared about them. And that, you mentioned already in Massachusetts. So if you're talking about law enforcement interactions, right? So Eric Garner was a law enforcement interaction that began because he was dealing in loose cigarettes in New York illegally. There are many, many, many other examples. Even up until the last month, we've seen examples of police interactions inside of communities, often with young men of color, beginning with some kind of tobacco violation, whether it's an underage purchase of tobacco or something like that. In Massachusetts, in 2020, I think they had 10 seizures, 10 illicit tobacco seizures. In 2022, they had 300. So that's 300 incidents where cops were interacting with some kind of illicit tobacco trade and an opportunity for something really bad. But then you just have consumers who feel stigmatized. Stigma does not help if you're trying to quit, especially it turns out if you're a Black woman and a mother. Stigma surrounding your smoking behavior only makes you, it seems like, only increases the desire to smoke perversely. So, bans like this aren't necessarily helping the people they are supposed to. And I do want to make it very clear, when it comes to smoking in this country, public health has done a phenomenal job over the last 50 years. Smoking is almost eliminated. The youth cigarette smoking rate in the country now is around 1% or lower. That's phenomenal. So this is still a problem. I agree with Peter, or I agree with everyone. We don't want to advocate for people to smoke. We want to encourage people to quit smoking, but a prohibition, this route now in 2023, after we are just trying to drag ourselves out of several other prohibitions, is just, it just seems illogical. It seems destined to fail.
So, Michelle, I want to follow up on that public health issue. Really interesting. One of the things that I think from a public health perspective is tobacco harm reduction, right? And do you have information or can you share any research on how the use of vaping and tobacco harm reduction has really helped the adult smokers? And that's one. And so again, here we're taking a choice from adults, right? All adults. And removing an efficacious, scientifically studied, empirically researched solution that helps mitigate the damage from smoking tobacco.
It's really problematic that in the United States, we've decided to define tobacco as just everything with nicotine, pretty much that isn't an FDA-approved nicotine-containing medication. Because whether it's e-cigarettes, snus, which is a Swedish oral tobacco, heated tobacco products, if you look around the world, the countries that have embraced one or several of these, I mentioned that you can't just ban your way out of something unless you factor in the demand, unless you reduce the demand. And the countries that have embraced these other products, they've done that. If you look at Japan, for example, they legalized heated tobacco products. So they heat up the tobacco, but they don't burn it. So it's safer, significantly safer, somewhere around, we think 90% safer than smoking. So not perfect, but way better. And in Japan, they embraced that. And within 6 years, their cigarette sales declined by half or more. That's astounding. And if you want to talk about addressing a problem here in the United States, like menthol cigarettes, for example, yes, it's true that the proportion in the Black community of people who smoke menthol is way higher than in other communities. What would be helpful, more helpful certainly than a prohibition, that's definitely going to drive people to other sources, is to present, give them a market of other opportunities, other things that are safer and satisfying without just saying, you're a horrible person, quit or die. And so, the FDA's own analysis, when they introduced this prohibition, the proposal to prohibit menthol cigarettes, they relied on people switching from menthol cigarettes to menthol e-cigarettes as half of the benefits that they predicted would be derived from a prohibition. Yet, the FDA has not yet authorized a single menthol e-cigarette in this country. And they've signaled that they have no plans to do so in the future. So, you are not giving people any other route to get out of smoking that isn't going to put them in the path of police or some other tragic consequence. And I really do want to point out the fact that there's another side to the illicit market that is very dangerous that I don't think people who advocate for policies like this think about often enough, which is when the illicit market increases, and specifically also when it becomes part of the community, accepted part of the community, that is where children get access to illicit products. Mm-hmm. Right. So right now, the primary way that young people get access to tobacco products and other drugs is social sources. They get them through their friends. But as you have more and more dealers that you can see, that you're familiar with, that that other adults go to, that no one particularly cares about, it becomes much easier for youth to use those sources as well. And they are not always just selling, flavored e-cigarettes or menthol cigarettes. If you look at those 300 seizures in Massachusetts, there's fireworks, there's firearms, automatic weapons, and tons and tons of other types of drugs besides nicotine-containing products.
Thank you very much for that answer. It's really interesting because I don't know if our panelists are familiar with the Truth Initiative, which is the anti-tobacco group that really talks about the what about the children message. They just came out with a very interesting report that their goal is to eliminate any tobacco product in the United States in the future. Like that, their goal is to eliminate smoking en masse for all Americans. And again, this is an incremental, the menthol ban is an incremental step to that. And what I also, to support Michelle's statement on what other countries are doing, in the United Kingdom, their public health system actually gives smokers vapes as a form of harm reduction. So here's a government who basically recognizes smoking's not good. We want to mitigate that, and they support the use of e-cigarettes and other products in order to mitigate, and really are looking at it from a health perspective. So, Chief, I'm going to ask you this: what do you see as these costs? Unfunded mandates, lack of resources, and the burden on your troops, right? This is really important. It's the burden on the troops.
Absolutely. And again, another great question. So I'm going to go in a space of unfunded mandates, very similar to what we see in the mental health space. Right now, it is reported 37 to 44%. And if those numbers aren't higher in our jails, in prison systems. And again, that's an issue because the health facilities and resources aren't properly mandated. And so that falls on police, who are also not well equipped and not funded in that space as well. And so it now puts us in a space that you just really aren't properly equipped to address. And it becomes more problematic for a law enforcement agency to address something that you're just not well prepared to deal with. I think that where you are utilizing law enforcement once again to address an issue or an issue without the resources to properly do it, they become very creative. And when police officers and agencies become creative to address a concern of policies, we find ourselves in trouble. Eric Gardner issue has been brought up a number of times. And again, not to judge the situation as a whole, but where you realize a very minor policy elevated into an individual losing their life and it put an agency and law enforcement throughout this country in a very critical state. And so we should not find ourselves in that space at all. And that is what happens when we're unfunded to address a proper situation.
Absolutely. I was looking at the senator's letter again, and Noble is actually quoted in it. And what they talk about is law enforcement officials have raised concern that FDA's actions could inadvertently expand black market tobacco sales. For example, a coalition of approximately 700,000 law enforcement officers said the following about a ban on menthol: it will increase multiple categories of crime in our community. And I think we know that. And, John, I'm going to flip it over to you. And, you've talked about data before and how maybe the FDA isn't seeing the law enforcement data, and, maybe they need to go down to the border, right?
That's correct. That's the whole idea of convening the people with the relevant experience up front before you issue the unfunded mandate. The police offer ride-alongs. I put this offer out there. Any member of the FDA, come with me. I'll walk them through my neighborhood. I'll walk them to the corner. I'll walk them to the bodega or the vape shop, and they can see. Pete mentioned those cigarettes, and God only knows what they're loaded with, and they're a threat to the wellness of the young children who are going to be consuming them. But data and real experience are important. I'm sure the FDA has good intentions looking out for America's wellness, but they do not have the law enforcement capacity, knowledge, or expertise. Certainly aren't going to have their folks stand post at the border. They do not have the background to deal with the inevitable consequences. Their policy mentions going after distributors, sellers, wholesalers, and so forth. Who's going to do that? There is no magical kingdom law enforcement component that is properly resourced and equipped to deal with that inevitability. So, my point to them is, and other agencies who may pursue the same path, ultimately unfunded mandates and bans are shortcuts. And shortcuts too often are nothing more than a quicker route to failure. So let's rethink this. Let's hit the pause button. Let's get all the relevant groups together and think this through.
Fabulous. Thank you, John. Peter?
Yeah, I just want to touch on something I briefly touched on earlier, and it's when we talk about these illicit markets and the groups that then go out and look to go after the funds that are proceeds of these illicit markets. We talk mostly about drug dealers. I said I'd seen some instances where it involved people in the tobacco trade. I also will tell you that, in my experience in South Florida, for example, a lot of them went after people who were involved in Medicare fraud. It's folks targeting any illicit money that they don't think will be reported to police. Now, you might ask yourself, well, how the heck did ATF find out about that? Well, you know how? It's because in many instances, just like the police, sometimes you hear a story about the police having a search warrant they got from an informant that was wrong. And the Breonna Taylor case would be an example, right? The information wasn't exactly spot on. All right, well, a lot of these home invasion groups get information from the streets as well. And let me tell you something. I've seen and interviewed people on both sides, frankly, victims. And I spent about a year of my career, not every day, but traveling around the country and interviewing people who were involved in these robberies to try to get in their head and see what they did, how much preparation they put into those robberies. And it was astounding. But of the victims, oftentimes these were people who they weren't involved in the illicit market, right? But someone tipped off these home invaders that they were. And once these folks got into the house of these victims, being informed that these people had a lot of money or contraband, when these victims said, hey, I don't have it, they didn't just take their word for it and leave. I've seen cases where people were burned with irons. I've seen cases where daughters were raped in front of their fathers. I saw one case in particular, I wasn't the case agent, but I was there for the interview, where they took a newborn baby and put the baby in the microwave, demanding to know where the money was, and kept pushing buttons. But for the grace of God, they never pushed the start button. They were in the wrong house. So, I mean, there are tobacco smuggling. Some folks think, hey, it's a victimless crime. That's not the case. And again, I don't know why we want to open up these doors for other people to become involved in these illicit markets. In 2008, 2009, 2010, there were more US $100 bills in circulation in Mexico as a result of illicit markets than there were in the United States, which is mind-blowing. But to touch on some of the other comments we made when we talk about public safety, look, when the law enforcement officers are tasked with doing things that are not popular, because as Sir Robert Peel said, we're supposed to be part of the community. I know John mentioned that as well. It takes a toll. I took the test to be a New York City police officer back in the mid 80s with 60,000 other people. They had a hard time getting 2,500 people to take that exam. Communities need their police. I can tell you in my last few years with ATF, I was in addition to being in charge of training, I was in charge of recruiting and hiring of special agents. We had a tremendous volume of people that were interested that came out of state and local law enforcement because they didn't feel valued in their communities anymore. Not a good thing. The other thing, I'll say, even on the federal level, we rarely saw people who came into law enforcement that didn't stay for their full 20, 25 years till they can get a pension and leave and do something else. I never saw people leaving with 3, 4, 5 years on the job. However, it's a phenomenon now that is taken off because people don't feel like the law enforcement profession is valued. So why in God's name would we come up with additional reasons for law enforcement to come into contact with the public, enforcing laws that the public doesn't buy into and doesn't believe in? It's a recipe for disaster.
Thank you very much, Pete. You know, before I start questions and answers, you know, I think it's such a profound conversation as we move forward when we start talking about what shared safety means in our communities, right, Chief? And I look at the progress that we've made in the last few years to really talk about community policing and that engagement piece, not from a top-down perspective where we in law enforcement are kind of, you know, advancing that, but where we're actually partnering as stakeholders with every member of the community that's represented, right? And so I think, you know, the FDA in their proposed rule, I can't even remember how many hundreds of thousands of comments that they got. Most of them were against the ban, not for the ban. And yet I haven't seen any response en masse from, hey, wait a minute, there's all these community members who have looked at this and said, can we rethink this? You know, so as we talk about questions and answers, and, you know, I don't see many, so, you know, we have plenty of time for questions and answers, but one of them is, as the audience considers next steps, who or where should we turn to within the government to express our concerns? And you know, hopefully, Anna, please feel free to share my email. And there are a number of organizations that have sent letters to the FDA expressing their concerns. I think every law enforcement agency and executive leader who has heard this message has the ability to send that same type of message. You know, I've been trying to schedule meetings with the FDA and with a number of other folks at the federal level. And, you know, some of the asks that we have is, let's study this. Okay, we have time. And why weren't some of these things done before? And so I'm happy to share some of those asks with any law enforcement leader, and I'll send them out. But, you know, there are, in fact, research components of the federal government that can take this on. You know, we could request the Committee on Law and Justice to conduct an assessment on the social justice issues, right? If as we're working towards health equity, you know, I like to think of how we've for so many years siloed off law enforcement from all the other systems that are more efficacious in preventing crime. We're finally at the place where we're not siloed, and we should never be siloed from all those other systems. We become first responders because we're the only ones that answer the phone in the middle of the night. You know, I think about my law enforcement career when we did municipal code ordinances that our officers were like, are you kidding me? We're going to go out and start arresting people for recycling, right? It is, you know, you had homeless people that were taking bottles out of the recycling, and there was, you know, city council it's like, no, you got to go arrest those people. And it was the same conversation that we're having when smoking bans occurred in bars. I remember being a officer, and all the officers were like, why are you sending us in bars to tell people to stop smoking? Let's engage in public service campaigns. And we don't want to put cops in the position of defying the laws, right? But, you know, it's how do we appropriately teach them about discretion, and, you know, why are we imposing all these mandates and then giving it to the people whose only resources are criminal sanctions? Is that the most appropriate resource given where we're at right now with crime, violence, and other issues in our society? So I'm happy to share with folks some of the asks that my organization has done. You know, we want to request the Committee on Law and Justice to do an assessment on social justice. How is this going to impact marginalized communities, and is help a better way of addressing the issues versus criminalization? We would like meetings and focus groups with law enforcement unions and personnel at the local, state, and national levels to understand what enforcing menthol-flavored cigarettes bans would mean on their day-to-day work. You know, and the last one is request the Department of Justice and Department of Homeland Security to conduct a comprehensive study on the implications of what this illicit menthol cigarette market would have on public safety. No one is saying, how are we going to enforce this? And what is the burden when we literally turn over a $30 billion market to the worst bad actors in our society? So, you know, I'm happy to share my email and happy to share templates and folks that you can send concerns to. But what I'd like to do is see if there's any other questions other than that, and then go into like some closing statements. So Michelle, and take your time. We've got plenty of time. So.
Yeah, I mean, just to reiterate what you said, that there's time. Smoking is very low, and this is not to minimize the fact that there are smokers now who, there are ways they could quit. If they quit now, they would probably save themselves 5 to 10 years of their lives. That's very important. That's 5 to 10 years with parents, siblings, you know, grandparents, all of that. But criminalizing the behavior as a means of getting people to that better outcome has literally never worked. It has never worked. It has just pushed people into prisons, pushed them down and mentally, and made them worse off. It's very difficult to address those other factors that lead into behaviors like substance use or smoking, like poverty, mental health issues. You know, racism is part of this as well. Like racial trauma has been shown to actually correlate to an increased likelihood of smoking. Those are very tricky, difficult things to address if you're a policymaker, if you're a regulator, and we understand that. You know, the ban hammer, you know, the ban hammer is just, there's a nail, I'm going to hit it. And it seems like it's a really good idea. But then you get, for example, let's say the FDA banned flavored cartridges for e-cigarettes, and then the FTC announces that there's been a surge in disposable e-cigarette by youth, and then, you know, then the FDA says we're going to ban flavors and everything, and then there's synthetic nicotine, there's this loophole, and then there's the cooling flavor instead of menthol loophole. There's always going to be loopholes, and I think when regulators like the FDA go into this, I would hope they have an end game in mind that they're maybe not sharing with the rest of us, but they really need to think through those steps and what's going to come afterwards. It's very difficult to predict how, you know, a cartel or consumers might respond, except in this case, it really isn't all that difficult because we have 100 years of examples showing us exactly how consumers and illicit operators react when something is prohibited. So just say, I think pause is a good idea, study is a great idea, and really talk to the people in these communities. I think the FDA should be sending people up to Harlem and South Bronx to observe and talk to the people who are already involved in that illicit market, the consumers and the participants if they can. But yeah, this is just a wrong-headed, well-intentioned it may be, but it's going to have pretty enormous consequences for consumers, communities, and obviously police.
Chief.
Yes, I think that it was well stated that criminalizing addictive behavior is not the answer to where we are right now. I think that creating a policy like this will open Pandora's box as it relates to what the illicit market will do to many of our communities. As it was stated that and it will actually have an impact on other crimes as well, very much like what we saw with marijuana, as well as in the crack epidemic. One could associate that burglary was increased during that particular time because you had people just going after trying to get a $10 fix. And so I think that we will see something very similar as to that. But also, it disenfranchises the minority and the already disenfranchised communities even more. And I think that clearly more study need to be done in this space. And a lot of attention need to be put on the unintentional consequences, because clearly just in this small group of professional people, we see things that clearly they should have recognized that needed to be addressed before pushing something like this even forward. So there's a lot of work to do, and if we have time, we need all hands on deck to address this.
Thank you very much, Chief. John.
Thanks, Diane. About a year and a half ago, Noble took the lead in convening the national law enforcement organizations in drafting a letter expressing our collective concerns and addressing that letter to the FDA. And part of what the letter asked for respectfully was a seat at the table so that we could provide our collective experience to help guide them in their mandate, in what they're attempting to accomplish. And unfortunately, we did not get a response. And while that in and of itself is troubling and a process failure, I think we really need to sustain panels like this to consider, or to continue rather, elevating the voice of reason, the voice of experience, discussing the impact, how it's going to impact police and community relations, officer safety. Telling you right now, I did not want to go to Police Week and have to see one officer put on our sacred wall because of a situation involving illicit tobacco products. I don't want to see that. And, you talk about, Chief mentioned about, banning addictive behavior. Much like Pete, I'm not a smoker either, but I am a coffee drinker. So now I'm getting a little nervous thinking, what's next, caffeine? And I'm thinking, what are my options going to be? Wrong approach. We know better. We're better as a country. We're smarter. Let's just think it through again, reconvene. There's no reason why we can't hit the pause button and bring all the people to the table. Because when we, as a government or as a country, it's not so much that we're losing a seat at the table, but when you throw the table away, we diminish due process. We diminish everything about our democracy that we value. So let's get that table back there. Let's get backsides and chairs. Let's pull down the shades, get the coffee going, and let's think and discuss this and work it out.
John, you say something so interesting relative to the issue of coffee as a drug. I have a T-shirt that says, "Nice people use drugs," right? I'm like, I have a French press, and if I don't wake up every morning and have my 3 or 4 cups of coffee and maybe a glass of wine at night sometimes, right, we have to stop stigmatizing and thinking we're going to achieve a drug-free America. That is an impossibility. And, just like alcohol prohibition, we know we mitigated the harms of the mafia by returning back to sensibly regulating alcohol. And I think alcohol is a horrible drug at times, right? There's a lot of issues, but there are so many other ways to mitigate issues and leave law enforcement. If someone gets in a car and drives we should arrest them. But if someone's an alcoholic, we should have resources for them to reduce the harms. And today we know, we still have moonshiners, but that's so small. And it's not as harmful to our communities as this wholesale giving over a market that to me is really frightening. It's gonna result in not necessarily the best outcomes, and we ought to be looking at how do we solve public health issues from a public health perspective. So, Peter, I'm gonna give you the last word, then I'm gonna turn it back over to Thomas, who's our host.
Sure. Hey, it's been a tremendous honor to be here. And Diane, you pointed out when you introduced me, look, I was involved in the exoneration of 8 innocent people who went to prison for murders they didn't commit. One was in prison for a quarter century. Exonerations doesn't mean that you're basically saying, hey, this person's innocent and getting them out. You're basically calling out a police investigation, a prosecution. These involve battles with district attorneys' offices and police departments, and sometimes some of my own former peers that aren't pretty. Later on in my career, I was a whistleblower in the Operation Fast and Furious case when I saw my agency get it wrong, and in another case that John's familiar with involving a grenade trafficker. Again, these were battles. It's not the easy path, but they were important, and I prevailed because I stuck with the truth, because I think law enforcement needs to have integrity. It needs to be pure. Look, those were small things when you think about the bigger profession. I'm also law enforcement's biggest cheerleader when they get it right, but I'm not afraid to call them out when they get it wrong. I have lost over the course of my career over 12 close friends, 7 on 9/11 alone. The profession is very near and dear to me, and that's why I'm so passionate about them getting it right and their importance to be trusted by the community. What I don't like with legislation like this is it offers an opportunity to instill greater distrust in a noble profession. And that's why I really wish that folks would think this through better. And I wish they would have asked the opinions of the people who actually put on a gun and a badge every day and go out there and in pure heart protect the public. Because we're where the rubber meets the road. Just like that young kid that's out there slinging cigarettes is the face of the tobacco smuggling industry. And some of them are just people who are, in poor circumstances trying to feed themselves. They're the ones that are going to come in contact with what I believe to be a noble profession. Why allow them to have the possibility for poor interactions that are really unnecessary and not a public safety issue, but rather a public health issue? That's all I have. Absolutely.
I'm very honored and want to thank our audience and want to thank each of our panelists and the Memorial Foundation for really a robust conversation. And please, if anyone wants to reach out to me and my organization, I'm happy to sit down and talk people through drafting letters and building this coalition. And I want to end it with, the FDA, we want to be a partner. We want to be an asset, and we want to help out this issue and work with the FDA. This is not about being adversarial in any way, shape, or form. It's just saying, hey, law enforcement deserves a seat at the table.
Wonderful. Well, thank you so much, Diane, for moderating a terrific program today. And thank you to all of our panelists, Chief Bryant, John, Peter, and Michelle, for participating in this discussion. Everybody did an excellent job, and I really hope that this moves the needle in the direction that it needs to go. We thank you, our audience, for tuning in today to Unintended Consequences, Law Enforcement Perspectives on Federal Policies. If you enjoyed this program, please consider checking out our podcast, Precinct 444, where we share other conversations like this one held today. And the next time you find yourself in Washington, D.C., please pay us a visit at 444 E Street Northwest and experience the story of American law enforcement. Thank you again for watching, and have a great day.